Hello, my name is Kelly Courtney, and I will be presenting Special Needs Project Type 1 Diabetes. Type 1 diabetes is also called juvenile diabetes or T1D. People with type 1 diabetes do not produce insulin. Some of the risk factors involved in type 1 diabetes are family history, early diet, autoimmune conditions, HLA complex on chromosome 6, viral infections, race, ethnicity, and geography. The management for type 1 diabetes is there's no cure for type 1 diabetes. Condition impacts and effects on nutrition. Type 1 diabetes is an autoimmune disease that confuses the body's own immune system into attacking the pancreas, destroying the insulin-producing beta cells, and as a result, the pancreas is unable to produce enough insulin to regulate glucose levels, the main source of fuel for the body. The body breaks down sugars and starches you eat into a simple sugar called glucose, which it uses for energy. The pancreas releases insulin that allows glucose to enter the cells to be absorbed. Without insulin, cells in the body cannot survive. In addition, excess glucose can make the bloodstream too acidic, resulting in diabetic ketosis, which can be fatal if not treated. Some of the symptoms attached to type 1 diabetes have a direct impact on nutrition, such as increased thirst, frequent urination, extreme hunger, and unintended weight loss. The condition impacts and effects on physical activity for type 1 diabetes is that it makes exercise easier to control your blood glucose or blood sugar level. Exercise benefits people with type 1 diabetes because it increases your insulin sensitivity. In other words, after you exercise, your body doesn't need as much insulin to process carbohydrates. Sometimes people experience a drop in blood glucose during or after an exercise, so it's very important to monitor your blood glucose, take proper precautions, and be prepared to treat hypoglycemia. To learn how different types of activity affect you, you should be frequently checking your blood glucose before, during, and after an exercise session. Symptoms that are attached to physical activity and type 1 diabetes are irritability and mood changes, fatigue and weakness, and tingling or loss of feeling in feet, and blurred vision. The treatment and management for type 1 diabetes is meeting with your healthcare professional, blood glucose testing and monitors, fast, long-acting insulin analogs, oral medications, pumps or pens, also known as injectables, and alternative medicines. A treatment plan would be discussed between you and a healthcare professional. For management, there's no real cure, and it requires constant, careful self-management and good medical care. Learning how to monitor your blood sugar and keep it regulated is very important, and to stabilize your blood sugar levels on a daily basis and follow your doctor's treatment plan. Long-term implications or complications. Studies show that keeping blood glucose, blood pressure, low-density lipoprotein cholesterol levels close to normal can help prevent or delay problems. If blood sugar levels get too high or too low, serious complications can occur, but with proper management, you can be able to maintain a healthy, active life. Improper management can lead to damage of the heart, blood vessels, nervous system, teeth and gums, feet and skin, or even kidneys. Some of these complications include cardiovascular disease, eye conditions, foot neuropathy or sores, wound healing issues, sexual dysfunction, kidney disease or failure, and pregnancy complications. Some other information about type 1 diabetes is these commonly asked questions. Who gets T1D? Only about 5% of people with diabetes have type 1. It's more common in whites than in African Americans, and it affects men and women equally. Although the disease usually starts in people under 20, it can happen throughout any age. And how do you get T1D? Studies prove that T1D results from a genetic predisposition together with an environmental trigger. As we went over those risk factors mentioned earlier, that's that combination that we're now talking about. As a review, type 1 diabetes, also known as juvenile diabetes or T1D, is an autoimmune disease. T1D can have little impact or effect on the body's natural systems if regulated and controlled with support of a healthcare professional. And last, long-term implications also depend on regulating blood glucose, blood pressure, low-density lipoprotein, cholesterol levels. Here are some of the resources that I used when looking up my topic of type 1 diabetes. Thank you.